You're listening to the Body Contouring Academy's Proven Profits podcast, where you'll learn simple, actionable strategies from real-world, wildly successful body contouring professionals to help you generate more revenue, realize the profits you deserve, and create the life you desire. I'm Shannon Schimmel.
And I'm Kay Overly, and we're your hosts of the Proven Profits podcast.
Welcome back to the Proven Profits podcast. I'm Shannon, and Kay is with me, and this is episode 008, Conversations with Established Patients. These are do's and don'ts that lead to consultations.
Initiating conversations with your existing patients that lead to sales. That's what you want. But you can't stop at simply initiating. You've got to carry them far enough to end in an appointment for a consultation. All right, so you're ready to start initiating. You have props in and around your office, and your entire team is wearing buttons. All of you promoting your body contouring treatments and inviting comments. You want patients to take notice, show interest, and ask about your new offerings. But when you're first starting, those first conversations can be a bit or a lot scary.
Today, we're going to guide you through these conversations. We'll give you directives on how and how not to communicate, examples of what to say and what not to say, and ways to keep the conversations going. So, let's get started.
First, understand that patients have different expectations of team members and of providers. Because of these differing expectations, your team members should be much more promotional, warm, excited, and enthusiastic than you as the physician, NP, or PA.
So, how do your team members show warmth and excitement and enthusiasm about your body contouring treatments? It starts with something as simple as a smile. A smile, or an absence of a smile, is a form of nonverbal communication. Have you heard the adage that communication is only 7% verbal and 93% nonverbal? Well, we're not sure if it's that extreme, but nonverbal cues such as smiling are huge in human interactions and especially in the sales process.
Your team members must have enough basic knowledge about your body contouring services that they can speak about them with ease. Each one of them may not have enough working knowledge to take that conversation all the way. So we recommend that you select at least one team member as your designated body contouring team member. The rest of your team can refer to that person after the initial conversation with the patient. If you can select more than one, that's even better.
So here's the communication basics for all team members.
Smile, sincerely smile.
Take notice when patients are looking at props and initiate conversation that the patient doesn't.
Be excited and enthusiastic about the treatments.
Share with the patient their own experience with the treatments, if they've had the treatments done.
Use open-ended questions as opposed to yes and no.
Keep conversation going with more talk, even if a patient seems to kind of fade away.
And don't allow those conversations to ever end on a bad note. Always reply with something positive.
In the conversation with, "Great, I'm going to ask Yvonne to speak to you briefly. She's an expert at these treatments."
If the patient declines to speak to Yvonne, the team member should say something like, "Okay, I'll tell her about your questions. She may email you some information or maybe give you a call. How does that sound?"
What if the patient declines to speak to Yvonne with a comment like, "Oh, don't worry, I don't want to bother her"? Well, your team member should reply, "Oh, it's no bother at all. Yvonne loves to talk about body contouring."
The team member's ultimate goal is to get the patient with Yvonne while the patient is at the office. That's what enables Yvonne to schedule that consultation, which should ultimately lead to a sale. But in the alternative, if your team member is not able to get the patient with Yvonne, the patient will have noticed that Yvonne will be emailing and or calling her to provide more information and hopefully get her back in for that consultation.
The key is to get that conversation started and a consultation scheduled while the patient is in the office and while that patient is hot, meaning those emotional buttons have been pushed. Remember, buying is an emotional decision and we justify it with logic.
Okay, let's move on to providers. The provider is seen by the patient as the ultimate authority for the reason that they're there at the office. Failure on the part of the provider to convey to the patient their interest in and attention to the patient's chief complaint can result in disastrous results, including losing the patient entirely. I had a patient at one time come in for Botox, and she had previously had Botox at her ophthalmologist's office, and I came to realize, based on what she told me, that she felt like her ophthalmologist was ignoring her eye needs by encouraging and recommending Botox. She even had Botox treatment that day with the ophthalmologist and liked her results, but said she would never go back to that doctor for either because of the fact that the ophthalmologist was, she felt, pushing Botox during the eye exam. As we previously stated, with rare exceptions, providers approach this differently from your team members. Providers should not initiate conversations with patients about body contouring treatments, and listen to some basics for providers.
Patients expect their providers to be attentive to their medical needs when they're in the office for a medical reason.
Even though it may be acceptable for your team members to ask, "Hey, did you hear about our new treatment that blasts fat?" The provider should never do this.
The provider should never initiate the conversation about the body contouring treatment with the patient.
But the provider should be very well versed in the treatments and have the ability to field any questions from the patients.
Though it's personality-based, most providers are more comfortable discussing the treatments from a standpoint of safety, efficacy, and more clinical and research-oriented.
And the provider should be willing to share the fact that he or she had the treatments done him or herself with the patient and talk about that with the patient.
Even if the patient asks about the body contouring treatments, the provider should tell the patient that he or she will take care of the reason why they're there first, then discuss the body contouring afterwards.
And finally, the provider should be very free to discuss how members of his team have had the treatments and how happy they are with their results and just after the treatments.
So your action step for this episode is block out time for your body contouring team members to create sample scripts for the rest of your team. Then block out your team members to role play with the scripts. The more the team gets practice, the more comfortable and effective they'll be in guiding the patients down the path from that conversation down to consultation and ultimately to a sale.
Part 2 of your action step is you're ready to set goals. Put your team members' practice to work. Set a daily goal or a weekly goal of consultations scheduled from patients in your office. Make it fun and give incentives. Have a contest with a reward for the most patients scheduled.
Well, that's it for now. Stay tuned for next week. Hit subscribe so you don't miss a single episode. Bye for now from Shannon and Kay at the Body Contouring Academy's Proven Profits